Welcome, welcome, welcome. Come on in, come on in. You know me, I'm Dr. Melva. I'm Dr. Melva. Today we are broadcasting live. Mic check 1 2 1 2. Hope everybody can hear me. Looks like my light. I see this line. I don't know where this line's coming from. Welcome, welcome, welcome. Come on into the call. Come on into the live broadcast. Thank you so much for joining today. I'm Dr. Melva. You know me. I am your board certified radiation oncologist, and I help people that have been diagnosed with cancer through my videos, speaking, and community cancer centers to take control of their lives, navigate the cancer care system, and live a normal life in spite of cancer. You can find me here on Facebook /Dr. DOCTOR Melva. Come on into the live broadcast. Thank you so much for joining. Thank you so much for joining. It looks a little blurry. Sorry. Technical difficulties. I think I got something on my phone. Can you see me or am I blurry today? All right, so we're broadcasting live if you're catching the replay. Thank you so much for joining. Hey, Tiffany, thank you so much for joining the live broadcast. Today we were talking about 3 tips for you with your first oncology appointment. 3 tips for you for your first oncology appointment. If you're getting value from these segments, please share. Sharing is caring. Sharing is caring. All right, I have to work on that. Getting a message coming in. All right, so I have 3 quick tips for you. If you're just joining, I'm Dr. Melva, and I'm your board-certified radiation oncologist. I help patients diagnosed with cancer, and today we're going to be talking about 3 tips for you for your first oncology appointment. So, number 1, I hope somebody can hear me. If not, let me know in the comments. Let me know in the comments. So, welcome. Today is Thursday, August 24th, 2017. We're broadcasting live from Chesapeake, Virginia. So 3 tips for your oncology visit. Number 1, when you leave or before you leave, you want to make sure that you understand what your disease is and how it will be treated and why we are treating it that way. Okay, just a couple things. You don't have to know it at a deep level, but you have to understand why you're there. Thank you for joining the live broadcast. Welcome, welcome, welcome. Welcome to the live broadcast. Welcome, welcome, welcome. So number 1, you have to understand why you have the cancer, why the treatment is being offered, what they're going to follow, as far as guidelines. You have to understand that entire process. And I say that because I get a lot from patients that, oh my gosh, you're good. That's good. You really explained it. Dr. Melva, you sat down and took the time to explain it to me. And I'm saying this because that shouldn't be anything that I'm being thanked for. It should be automatic. Okay, that when you go to an oncology appointment that you feel. Number 2 is to be comfortable with the information that you're receiving. Welcome to the live broadcast. This is Dr. Melva. We're talking about 3 tips for when you go to your oncologist. Number 1 is that you should understand your diagnosis and what your treatment will be, where you can understand it and explain it in your own words. Number 2 is you should be comfortable with the diagnosis. Welcome to the broadcast. Welcome to the broadcast. You should be comfortable with the information that's being given to you. Not uncomfortable, but comfortable before you leave that appointment. And number 3, you're not in this cancer diagnosis. You're not here alone, okay? So those are 3 tips. Today's a quick one. Sorry, it's been a long week. A long week. Thank you so much for joining the live broadcast. I know these were short, but I'm going to recap them. There are 3 tips that you need when you go to your oncology appointment. So 1, I want you to understand why you're being offered this treatment, what the stage of your cancer is, what things they're going to follow to be able to tell you how you're going to be better. But understand whatever it is in a way that you actually understand it, okay? And again, that's because I get a thank you so much from patients. as if I'm the only person in the world that's explaining things. And I know that's not true. So I want you to expect that from your physician and make sure that you ask to have information on a level that you understand, okay? It's a way to break these things down so that you don't have to go to school for the 14 plus years that I did to understand what having cancer is and how to treat it. Okay, so it should be broken down in a way that you can understand. Number 2, you should be comfortable. Welcome to the live broadcast. Thanks so much for joining. If you're getting value, please share. Sharing is caring. I'm Dr. Melva. If you're watching the replay, we're talking about 3 tips for your oncology appointment. Number 2 is that you should be comfortable with the information that you're being given. If you leave the appointment and you have questions out of the roof, or you really just didn't understand, you deserve to be comfortable with understanding the information about your body, okay? And number 3 is that you're not in this alone, all right? So as a physician, as a radiation oncologist, all the members of the cancer team, their support. So if things are over your head, if you just don't understand why you have a lab drawn, a test ordered, how they're going to follow things, you are not alone. Okay, we are able to help you with that. Thank you so much for joining the live broadcast. So those were 3 quick tips for you on your oncology visit. And again, today is short. It's been a long, long week, but I've had so many thank yous from my patients, and I'm grateful for that. But it's after I sit down and I explain and I make sure that it's not clear as mud. I make sure that it's clear as clear can be. And I feel this sigh of relief when patients leave my office, as if I'm the only person out of the, at least 4 to 6 other doctors or providers or people they have seen before me that has taken the time to really do this. So I want to teach you, before you go to your oncologist appointment or the next oncologist appointment you go to, if you feel that you're not getting those 3 things, I want you to be comfortable to ask for it. And I want you to know that you deserve it, okay? I shouldn't be an exception to the rule. I shouldn't be. I'm not doing anything special that I think, but I'm taking the time, I'm caring about my patients, and I'm explaining things so that they understand. And when they leave my office, they feel better about whatever the next steps may be. All right, so I'm Dr. Melva. Just to recap again, 3 quick tips for you on your oncology visit, your next follow-up once you've been diagnosed with cancer is 1, I want you to understand the information they're telling you. Number 2, I want you to be comfortable with that information. And number 3, I want you to understand that you're not alone. All right, I hope that brought some value. Thank you so much for joining. If there are any questions or comments, I'm happy. Thank you, Tiffany, for joining. Welcome, welcome, welcome. If there are any questions or comments, I'm happy to answer them. Again, I'm sorry this is short. It's been a long, long, long week, and I think it's blurry. I don't know why it's blurry. But again, this is Dr. Melva, and I am broadcasting live today, August 24th at 6:30 p.m. Eastern. From Chesapeake, Virginia. I appreciate you joining the live broadcast. Are there any questions, comments about anything I said? I know I went over it really fast, but today we were talking about 3 tips for you when you go back to your oncologist for the first time with your oncology visit or for a follow-up visit in addition to it. So let's slide and see if there are any comments. I'm happy to answer questions. Thank you so much for joining. I hope this was valuable, short but quick. Again, it's been a long, long week. It's only Thursday. Sorry, I know I look a little tired today. All right, if there are no questions, thank you so much for watching. If you catch me on the replay, thank you so much for joining. You can follow me here. Again, I'm Dr. Melva, and I help patients that have been diagnosed with cancer through my videos, speaking in community cancer centers, navigate the cancer system, transform their lives to live normally in spite of a diagnosis of cancer. You can find me here on facebook.com/Dr. spelled DOCTOR Melva, MELVA. Thank you so much for joining. Until next time, bye.